And now I would like to recognize a colleague of mine, another person who's shown great leadership on this important issue, and just a close personal friend of mine as well, the gentleman from North Carolina, Mr. Meadows.
Well, I thank the gentleman. I think more importantly his heart on representing the people of the great state of Indiana and the fact that he is concerned on a daily basis. We've had conversations a number of times on just not only how this health care law is affecting families, but truly how we must find a way to work together in a bipartisan way to stop the harmful effects on those men and women that we call neighbors, friends, and constituents. So I thank the gentleman for yielding. And, you know, Americans across the country are already feeling the impacts of Obamacare. And many of them are fearful of what lies ahead. And I know in my state alone, we've had over 473,000 people that have lost their health care coverage due to cancellations because of Obamacare. And, you know, they keep asking, you know, well, what's coming next? What's the next thing? You know, whether it's a website that doesn't work, whether it's cancellation policies, whether it's security concerns over the website that's existing, they're all concerned. I held a town hall meeting last night, and 85% of the callers and questions were all related to Obamacare. I don't think we've ever seen it so overwhelmingly lopsided in terms of one issue. And yet it was all about families. And for me, it was the families of Western North Carolina. I had veterans asking me, well, does this mean that I'm going to lose my health care coverage? Is TRICARE going to be sucked into the Obamacare? And even though we've had promises to the contrary, we know that there's a real move afoot to minimize and bring it down. And so our commitment to our veterans is one that has to stay strong, and we have to be committed to that. And I know that you agree with me on that particular issue. You know, there was a wife who was worried about how she and her husband were going to be able to afford the premiums because their premiums had tripled. And they said, you know, we just don't know how we're going to be able to afford it. And then I had a business owner who employs, you know, he said between 26 and 28 people. He employs, though, he says, I'm not sure how we're going to continue to be able to provide health care coverage as premiums escalate. And it's all about trying to make sure that I keep them gainfully employed. And now I'm having to try to figure out how we pay for these premiums that have increased. And so these are real people. This is not politics. They have faces and names, and we've got to address it. You know, people across the country have become gravely concerned, and recent polls showed more than 58% of the people believe that Obamacare is not ready for prime time. And despite this overwhelming stress over Obamacare, you know, the one question I continue to hear is, well, what's your solution? Mm-hmm. You know, many of the Democrats have claimed that Republicans only want to repeal the law rather than trying to fix it. But I can tell you that that's not the case, because even in this Congress, Republicans have offered over 102 bills to fix some of the problems with the Affordable Care Act, while the Democrats have only offered 17 solutions. Now, last week we passed one of those solutions, the Keep Your Health Plan Act, you know, to make sure that if you like your health care plan, that you can keep it. But much more needs to be done. The America Health Care Reform Act that you were talking about now has over 102 co-sponsors. It's a comprehensive solution that's put forth by House Republicans to address the serious problems that we have in our nation's health care system. You know, it's a multifaceted piece of legislation that provides an array of reforms and lower costs. You know, something that the current bill really doesn't do. You know, we talk about affordable care, but it hasn't really been lowering the cost. Mm-hmm. But this is one that keeps it patient-centered, allows to make sure that a doctor's, you know, that health care is a decision between a doctor and a patient, not the government and the patient. And so it provides those tax reforms for families and companies, and it levels the playing field for providing for health care for all Americans. You know, fully repeals the president's health care law, eliminates billions in taxes, you know, thousands of pages of unworkable regulations and mandates that we've already seen that we're only now starting to find out what the implications are. It spurs competition. to lower health care costs. We know that competition will do that. And yet it allows for the purchase of health insurance across state lines, enabling businesses to kind of pool together, small businesses, to lower those health care costs. But it's really about reforming what we're seeing. It reforms medical malpractice laws in a common sense way that limits trial lawyers' fees, but yet at the same time does not diminish the protection for our patients if something were to go wrong. It expands health savings accounts, something that increases the ability for pre-tax dollars to make sure that what they can do is use those dollars to provide for their health care expenses. Ultimately, it's a safeguard. It safeguards us against those pre-existing conditions. I know you've heard from your constituents and mine that one of the good things about the Affordable Care Act is it makes sure those pre-existing conditions are covered. This does the same thing and makes sure that they're protected, with yet at the same time making sure that those high-risk pools are extended and guaranteed that availability, the protection that many of Americans depend on and need. I just want to thank your leadership on this particular issue. I believe it's time we work together in a bipartisan way to fix this problem piece of legislation. We've put forth a proposal. I urge my colleagues across the aisle to join us, and I thank you for your leadership in highlighting this evening, and I yield back.